Good afternoon, everyone. Today I'll be presenting the research I've collected in my EFD 691 and 692 Advanced Research and Education 1 and 2 course. The research that I chose to conduct will be on reducing the risk of sports-related injuries in female athletes, specifically the ACL. The hypothesis I look to prove today is that a lack of specific weight training exercises is one of the major contributing factors that makes female athletes more susceptible than male athletes to sustain ACL injuries. The research suggests that other contributing factors for an ACL injury include fatigue, jumping and landing techniques, and hormonal factors. The purpose of my study. So many studies show incorporating neuromuscular training can significantly reduce the number of ACL injuries. In the United States alone, there are approximately 7,000 female athletes who sustained or ruptured an ACL in 2002, making the injury rate 1 of 65 participants. The mechanism causing these injuries falls under 3 categories: planning and cutting, straight knee landing, and one-step stop landing with the knee in hyperextension. By strengthening the quadricep and hamstring muscle, female athletes are less likely to injure their ACL. With the treatment of the data, research suggests that incorporating a neuromuscular program during early adolescence for female athletes will enhance their sports performance and significantly reduce the risk of sports-related injuries. Typically speaking, it takes a minimum of 6 to 8 weeks of training that's needed for these athletes to see improvements. Taking a closer look at the treatment of the data, the benefits of neuromuscular training have been seen by gradually implementing this specific type of training during physical education classes. It's been documented that female adolescent athletes have the greatest risk of ACL injuries, with the rates of 4 to 6 times higher than their male counterparts in similar sports. Female athletes are more susceptible to sustaining ACL injuries from the age 14 to 20. Taking a look at the risk factors for ACL injuries in female athletes. The 2 prominent risk factors in non-contact ACL injuries in female athletes compared to males are intrinsic and extrinsic. Intrinsic factors are those which are not modifiable and are characteristics of the athlete, not the athlete's movements. A couple of these contributing intrinsic factors of ACL injuries in female athletes include the following: hormonal influences, joint laxity, and structural differences. Now, taking a look at the extrinsic factors. Now, these factors are considered to be those that have the potential to be modified or altered by training. Contributing extrinsic factors to ACL injuries in female athletes includes the following: cutting maneuvers, jumping or landing characteristics, muscular strength, and muscular activation patterns. When jumping, the forces absorbed by the body are 3 to 14 times the body weight of an athlete. So an improper landing technique can increase the chances of an ACL injury. Increasing the strength of the quadricep and hamstring can significantly reduce the number of ACL injuries in female athletes. Studies have shown once an athlete sustains an ACL injury in one knee, the likelihood of the injury in the opposite knee significantly rises. Who's at risk? Research suggests females who participate in basketball, volleyball, and soccer are at a greater risk of ACL injury. Participating in these sports are usually involved in a lot of quick cutting motions, jumping motions, and rapid slowing and decelerating movements. Preventative training. Reducing the risk of an ACL injury begins with the female athlete being properly trained during neuromuscular training. Research suggests adolescent athletes can enhance their sports performance by regularly participating in a resistance training program. Regular participation in resistance training can also reduce the number of sports-related injuries. It is important to note that neuromuscular training programs teach female athletes how to better control the stability of their joints. This specific type of training can reduce the risk of females tearing their ACL to a similar risk as males. The three most effective components include the following: progressive strengthening for the core and lower extremities, plyometrics, and feedback-driven technique modification. Compliance rates were highest with coach-led programs. Taking a look at the weight training questionnaire, it consists of 15 statements. The statements are designed to analyze how students who participate in strength training exercises view their program and view the level of injury prevention exercises incorporated into those strength training sessions. The statements will focus on the weight training regimen, habits, and insight on how the students view their bodies. The questionnaire will be answered using a 6-point Locklear scale, which consists of qualitative answer choices from always to never. The ACL Injury Prevention Program practice checklist consists of 6 questions. I'll start that over. The ACL Injury Prevention Program practice checklist consists of 6 questions. It's designed to analyze the effectiveness of neuromuscular training and identify which functional areas athletes should target while performing neuromuscular training exercises. The ACL Injury Prevention Checklist will also determine how to reduce the risk of ACL-related injuries in athletes. The assessment checklist will be scored by totaling the responses using a 12-point interpretation scale. The checklist score interpretation will be determined how beneficial the preventative measures have been for an athlete using the following scale. So from 0 to 2, showing no benefit, 3 to 6, showing small benefits, 7 to 9, showing intermediate benefits, and then 10 to 12, showing a large benefit. The weight training questionnaire, as well as the ACL prevention checklist, will be distributed to the student athletes that participate in the following sports. This will be basketball, football, baseball, softball, volleyball, and soccer. Everything that the student athletes fill out in these assessments will remain completely anonymous. Next, you see the letter that will be sent out to the parents asking for consent for their son or daughter to participate in this specific assessment. In conclusion, a lack of specific weight training exercises is one of the major contributing factors that makes female athletes more susceptible than male athletes to ACL injuries. The research data collected from the ACL questionnaire and assessment should confirm athletes who have previously performed specific neuromuscular training as a preventative measure have significantly decreased the risk of ACL injuries compared to someone with limited experience. The compiled data from the ACL questionnaire and assessment should come from sports such as volleyball, basketball, baseball, football, soccer, and softball athletes. The results from the questionnaire and assessment should prove to be beneficial to athletes with limited experience in specific ACL neuromuscular training exercises. Pinpointing these athletes should help reduce the risk of sustaining an ACL injury. This concludes my presentation.